Coordinating care is the theme of Rare Disease Day 2023. To find out why it's so important for patients of rare conditions, I'm joined by Louise Fish, the Chief Executive of Genetic Alliance UK. Louise, great to have you here with us. First, though, I want to start by saying that this isn't the first time that ITM Business has collaborated with Genetic Alliance UK. Last year, we produced a film for you specifically highlighting how important it is for early intervention for babies born with spinal muscular atrophy. The film itself is both heartbreaking and heartwarming in equal measure, and we aren't the only ones who think so. The film has been nominated for 2 awards, and I'm delighted to say that it's won bronze in the healthcare and pharmaceutical sector for the Lens Awards. So tell us a little bit more about this film.
Well, we're really grateful to Ezra and his family for sharing their story. And as you say, it's heartbreaking, but it's heartbreaking most of all because it's a situation that could have been avoided. So the UK screens every newborn baby through the newborn blood spot heel prick test. And at the moment in the UK, we just screen for 9 conditions, but across many European countries, they screen for up to 20 conditions. And spinal muscular atrophy is one of those conditions. If it's screened for early and picked up early, then there's a new treatment available. And that treatment, if given quickly, means that there isn't the irreversible motor neuron damage that causes the kind of challenges that we see in the film with Ezra.
Yeah, and Ezra is very much the star of this film. So let's just take a little look now at part of the film where we're first introduced to Ezra.
Ezra struggles with many of the things most people take completely for granted: breathing, eating, even holding up the weight of his own body. But he's one of the first generation of SMA type 1 kids to make it beyond infancy.
Well, SMA is just one of many rare conditions that Genetic Alliance UK support. There are so many others as well that are lifelong and complex. Getting a diagnosis is clearly a challenge, but there are other major challenges as well.
Absolutely. As you said, these conditions are lifelong and complex. And what that means is people need to see lots of different health professionals on a really regular basis to get the support they need. And that can range from the GPs that we all see through hospital specialists, specialist nurses, occupational health specialists, physiotherapists, speech and language therapists, and in some cases, learning disability nurses. So it's a really wide range of professionals, and that means lots of appointments on lots of different dates in lots of different places. And it's a real juggle for families to cope with all of it.
It sounds like multiple appointments as well.
Absolutely, multiple appointments across different hospital settings on different dates, and it's a real challenge and a juggle for families.
Especially, of course, for families with school-age children as well.
Absolutely. So, parents will be taking time off from their jobs to take their kids to appointments, and kids will be missing school, which is a nightmare both in terms of their education, but also just socially in terms of their friends and missing out on those friendships, which are so important for all children.
Well, effective coordination of care clearly has so many benefits, as you've just described, but our health service is under so much pressure at the moment. Is coordinated care something that is feasible, that we can really see happening?
Well, it should be, because it makes a huge difference not only to the families that get better coordinated care, but also to the health professionals providing that care, who are able to work together much more effectively and provide the much better care that we know they want to. But at the moment, most recent findings have shown that only 1 out of 10 people with a rare condition is receiving any support with their care coordination. So it's something we really need to tackle, and it will benefit both families and the health service.
Well done with the campaign. We wish you all the best. Louise Fish, thank you so much for your time.
Thank you.